Hello, my name is Dr. Cele Richardson and I'm a lecturer in the School of Psychological Science at the University of Western Australia. Today, I'm here to answer all of your questions related to sleep. The first question is, why did you choose to study sleep? Well, in the third year of my undergraduate psychology degree, I enrolled myself in a unit that focused solely on sleep. Up until that point, I did really enjoy my psychology units and I also enjoyed my biology units. And I found that in studying sleep, this area perfectly combined my passion for both psychology and biology. As a clinical psychologist, it is very rewarding to work with individuals who have a sleep problem, as you can get improvement in sleep through treatment in just a few short weeks. As a researcher, I'm also passionate about evaluating and developing more effective treatments for sleep problems. How does REM sleep work? REM sleep is one of the stages of our sleep. It is characterized by a particular type of brain waves, by reduced muscle activity, and by rapid eye movements. It's also characterized by having more variability in your breathing rate and your heart rate. We get REM sleep at the end of each sleep cycle, and we tend to get larger or longer blocks of REM sleep in the latter half of the night compared to the first half of the night. REM sleep is really important for learning and memory, as well as the processing of emotional information. Is REM sleep for dreaming? Yes, we typically have most of our dreams in REM sleep. However, we do have thoughts and we experience imagery in other stages of sleep as well. Is it bad that I get more than the recommended amount of sleep? It's hard to answer that question, but there is a large variability in what is considered normal. There are some people who can get a short amount of sleep and feel good and function well during the day. And there are other people of the same age who need much more than the average amount of sleep to feel good and function well. This is why the National Sleep Foundation has a range of recommended or potentially appropriate hours of sleep for each stage of the lifespan. If you are getting a large amount of sleep though and not feeling good during the day and not functioning well, this might be a sign that there's something going on, and I would recommend that you speak to a health professional. How does sleeping all day and being up all night affect you? Well, our body clock is primed to be at its peak during the daylight hours and to be at a low point during nighttime or during darkness. So if you are sleeping all day and up at night, it's likely that you're not sleeping in line with your body clock. If you don't sleep in line with your body clock, this means that the sleep that you do have is likely to be of a poorer quality, and it's likely that you're not going to feel at your optimal or at your best during your waking hours. I wake up at the same time every night. What does this mean? Normal sleep consists of different sleep cycles across the night, and these sleep cycles last for about 60 to 90 minutes. If you're going to bed around the same time each night, it therefore makes sense that you're waking up around the same time during the night. This is an indication that you have gone through a sleep cycle and you're waking up briefly before entering another sleep cycle. So this is completely normal that you wake up around the same time each night. However, it can be unhelpful to be looking at the time during the night. Sometimes this makes people worry more about their sleep. So if you are regularly checking the time during nighttime awakenings, I would recommend removing the clock from the bedroom or perhaps not checking your phone to check what time it is when you do wake up. How does blue light affect our body? Within our eye, we have a photopigment called melanopsin, and melanopsin is most sensitive to short wavelengths of light that appear blue or green in colour. When our eyes detect light, it sends a message to our body clock, the suprachiasmatic nucleus in the brain, to shut down production and release of melatonin. Melatonin is the hormone that prepares us for sleep, helps us to fall asleep and stay asleep across the night. If we are exposed to bright, particularly blue light in the evening, this can mean that our body is not producing melatonin when it naturally should be, which means that our body clock may drift a little later and that we don't go to bed until later as well. Is there anything that can stop our body from producing melatonin? As I just mentioned, if we're exposed to bright light, our eyes send a message to shut down production and release of melatonin. So perhaps if our eyes were always exposed to bright light, this would be enough to suppress our melatonin. The pineal gland is the gland that is responsible for the release of melatonin. So potentially if somebody doesn't have a pineal gland or has some sort of medical condition that affects the pineal gland, this is another reason why people may not produce melatonin. Does sleeping with a light on affect your sleep? As I've explained, if your eyes are exposed to light, then this can mean that you're not producing melatonin when your body should be. And so if you are exposed to bright light within the bedroom, perhaps this could be negatively impacting your body clock. However, it really depends upon the wavelength or the sort of color of light that you're exposed to and the brightness of the light as well. Some younger children like to have a nightlight on in their room. Night lights are generally quite dim, so they're unlikely to have a large impact on the body clock, but having a nightlight can also perhaps make some people feel safer when they sleep, which promotes good sleep. I wake up hourly. Why is that? As I've previously explained, each sleep cycle lasts about 60 to 90 minutes, and it's completely normal to briefly awaken after each sleep cycle. For some people though, they take longer to fall back asleep after each sleep cycle. And so if you're noticing quite a number of awakenings during the night and it's taking you quite a long time to fall back asleep, this could actually be an indication of a sleep problem, such as insomnia. How does insomnia work? Insomnia is a very common sleep disorder, and it's prevalent in about 10% of the population. Insomnia is characterized by having difficulty falling asleep, difficulty staying asleep, and or trouble waking up too early and not being able to go back to sleep. To have an insomnia problem diagnosed, you would need to experience these sleep problems at least 3 times a week, and the sleep problem would need to have occurred for at least 3 months in duration. To have your insomnia disorder diagnosed, as well as having trouble sleeping, you also need to report having difficulties during the daytime, such as feeling fatigued or sleepy.